Hi folks, and welcome to this session from Primary Care IT, where we're going to take a quick gallop through a few of the tools that we produce. I'm Jeff Schrecker. Some of you may remember me from the days of when I was at the EMIS National User Group, and let's carry on. Just to say, if you have any questions, we have the Q&A box on the right-hand side of your screen. If you can't see that, just look at the top right of your screen where it says leave, and immediately to the right of that is a little speech bubble with a question mark in it. If you click on that, you'll get the Q&A box. If you have any thoughts that you want to ask us about afterwards, the other way to contact us is the email address on your screen, theteam@primarycareIT.co.uk. So what are we going to talk about today? We're going to go through a little bit about who we are at Primary Care IT. Then I'm going to talk about the OneResults, the OneMonitoring and the OneRecall tools. At the end, I'll put up a slide just to help you know where to get further information about these and all the other tools that we do from Primary Care IT. So first of all, a little bit about us at Primary Care IT. We're a bunch of folk from general practice, clinicians and management side, and we get a sad sort of buzz from doing fun stuff with the amazing tools that are available within EMIS Web. We've all been doing it for years. We all started sharing it through the EMIS National User Group at first, and that's what drives us, is doing great stuff that we can share to help practices get through the day's work, improve patient care, because let's face it, that's what we're all in it for, is for looking after patients, but also to make the practice run more efficiently and hopefully get home in time for tea or possibly even something a little stronger. We like working with others who have the same philosophy. We're not precious about our stuff, so if practices that we're working with come up with ideas, we love to incorporate them into the tools that we produce. But because we're sharing stuff, it's also really important that we do stuff properly. We're producing tools that are being used to look after patients, and obviously safety is really important, and making sure that it's all done right is really important. So to that end, we're registered with the Medicines and Healthcare Regulatory Authority. We're onboarding currently to the GPIT Futures catalogue, and any practice managers on the call will be interested to know that that means that when that comes live in August of this year, I believe, these tools will actually be centrally funded. And we're also well chuffed that we've won prizes for the tools that we've got. The prestigious John Perry Prize for Primary Healthcare Clinical Informatics. Last year, Dustin Saint, our founder, was awarded it for the work that he's done in developing the tools at Primary Care IT. So first of all, I'm going to tell you a little bit about the OneResults tool. So OneResults sits in your Zap Alert box. You'll be able to see down here, you've got OneResults perching at the top of the Zap Alert. And when you hover over it, it brings up information about the results that are present in the patient record. This is all driven by the clever stuff that runs in the background of EMIS Web, interrogating the patient record for drugs that they're on, for conditions and codes that are in the record, and then using the national guidelines on monitoring. So we can see here we've got an example. The patient's had a full blood count done on the 9th of October. It needs to be done every year because the patient's on non-steroidals. So we believe that people work much better, not just if they're told what to do, but if they're told why they're doing it. So all of these tools incorporate the guidance and the reason that that guidance is being given. You can see that the full blood count's got a little tick beside it, because that means it's something the patient needs and it's been done and it's all up to date. But if you look a little bit further down, you'll see that we've got the hemoglobin A1C here, has a little cross beside it. And that means that it needs to be done and it's overdue, or it's needed now. And here we can see that the reason this is needed is that we've had a raised blood glucose level, and therefore we need to be verifying with the hemoglobin A1C. So again, showing you what needs to be done, the related information and why it needs to be done. This tool we've found is really useful when we're doing meds management reviews, because you can quickly just hover over it and see what's up to date, what might have been overlooked, what needs doing. It also means that if you're consulting with the patient for another reason, you've just got rapid access to the information. You're not having to go digging in the investigation screen to see when stuff was last done. And the other tip is it's really handy for anyone taking bloods in the practice. I don't know about you, but as a GP, I'm a bit inclined to ask for what I think needs doing and forget to check the rest. We've got all our phlebotomists in the practice keyed up that if a patient comes for a blood test, they just have a look at this to see if there's anything with a cross, or indeed if there's anything that's going to come due very soon, so that that makes life easier for the patient and for the practice. So that's the OneResults prompt. The other prompt, which is just sitting below it in the Zap alert box, is the OneMonitoring. Again, this is driven by a whole series of smart concepts in the background running in a protocol that determines what registers, what monitoring the patient requires. And if you look here at the mouse over screen, you can see that we've got a series of sections. And in that section, you've got, first of all, what QOF registers the patient's on. So here, this patient's on the asthma register and needs a review for that register. The next section is the general information, so things like smoking, blood pressure, smears, all that sort of general stuff. In here, it's just showing you when it was all last done. The next section is QOF year alerts that haven't been done for 10 months. We're all familiar with the situation in April and May, where yes, the stuff needs doing, but it was actually done in November last year or even in January this year. So it's going to need doing before the end of the year, but it's not quite, doesn't need doing yet. If it needs doing now, it'll appear in this not done in the past 10 months section. But equally, we've got the section that shows you what is going to need doing by the end of the year. So if you've got your asthmatic patient who's well-known nightmare for getting in for their review, their asthma review might have been done 6 months ago, and you might decide, actually, you know what, I'm going to catch them now while I've still got them, while they're in the building. I'll get them and do that, and then that's done for this QOF year in case they don't turn up again. And we can see the date that that review was last completed in this final section of the panel, review last conducted. So it was done in July 2019. So you know what, let's get it done now, because I know that this chap never turned up, this lady who's had a smear never turns up. So it's got all the options that you need. And again, it's just giving you all that information quickly without having to go rummaging through the records. So I like to think of these tools as meaning that you can spend more time looking at the patient and less time looking at the computer. So I'm just going to bring up another couple of screenshots we've done of these panels for different patients. So that again, you can see here, this patient, everything's up to date here. But we can see that they've had a PSA done in the past. We're telling you they've not got any prostate condition, not coded as being for monitoring, but they have had a PSA. So it might be just worth checking the records in case something hasn't been coded. So we've got these little safety nets built in, just because we know that our colleagues don't always code everything immaculately. And again, another OneMonitoring. Here we've got a patient who's on a few more registers. So we've got the diabetes register, the hypertension register, and the obesity. We can see the general information here. And now you can see that this patient is actually overdue their foot check. It was last done in April 2019. So we need to look in, check up what's going on and make sure that that gets done. And then we've also got the other items that need doing by the year end. Obviously that foot check needs catching up by the year end, but also there's going to be a blood pressure needing doing within the QOF time frame. You can also see in the reviews section that we've got 2 booked in due dates for this patient. The annual review is booked in for June, and we've also got an interim review booked in December. And I'll just talk a little bit more about recall and review dates in a moment when we come on to the OneRecall section. So that's a quick overview of OneResults and OneMonitoring, rapid access to information about the patient from the top of your Zap alert box. So now I'm going to move on to talk about OneRecall. OneRecall is a fairly large project that started in our practice a number of years ago when we were trying to bring together all our recall schedules into one place. It's based on an assessment of the safest way of managing recall. So for all those issues that can be managed that need an annual or a 6-monthly recall but aren't particularly interval dependent, our core recall searches and schedule are built on month of birth. But we're also aware that there are issues, for example, where you have things like PSA monitoring. These are going to vary depending on clinical context, and you're going to need to do interval reviews. DMARDs are included in that as well. So we also, in the searches, we include searches for diary entries as well. So it's a combined month of birth and diary recall search system. The searches identify the patients based on the registers they're on and month of birth or any existing diary review entries. That supports the mailing out of recall and call and recall letters, and there's a built-in first call, second call, third call system. There are also tools which then help your admin teams to identify what needs doing when the patient rings in or calls in to make their appointment. As I mentioned, it allows for review dates, interval dates, or other follow-up dates to be created and amended by clinicians, and that's all supported by templates. You have recall built in for things like DMARDs, and the whole system integrates with the rest of our tools. For example, our One template, all the disease review elements have got this built in. So this is the call up which your reception will have. This is run off the F12 key. It shows when the invitation was sent, what the review status is and what's been done, what review is needed, and also a section here that says considerations that you may need. So for example, vascular, bring your urine test and the check for diabetes. It then has the links at the bottom for the reception to complete the tasks that are needed. You also have an alert when you see the patient. This patient's up to date for all their recall. So there's a mouse over box again that you can see where they're up to. If the patient were overdue for their recall, this would appear in red and have floated up to the top of the alert box. It again tells you when their invitations were, what their diary entries are for, which recall schedules they're on. So that's a quick gallop through 3 of our tool sets. I think I've just about made it in the 15-minute time slot. If you're wanting more information from us, you can go to our website, primarycarepathways.co.uk. If you look at on the support section into our knowledge base, we've got videos and details of all our tools. You can email us on that email address, the team at primarycare.co.uk. And please do join our Facebook group for updates on all our tools. Thanks very much for joining us. 15 minutes is a short time to get through all that, so I know it's been a bit of a gallop, but I hope you've gained some useful information, and please do get in touch with us if there's anything that any more information we can give you. Thanks a lot.